and welcome to this edition of the Native News Update on this Wednesday, February 9th. I'm your host for today's program, Paul DeMain. Some of the stories read here can also be found at our website, IndianCountryNews.com, and here are the news stories for the day from the Associated Press and other Native sources. Federal officials halted plans last Friday to ship bison to slaughter from Yellowstone's National Park after saying they had first had to review a court challenge filed by wildlife advocates. Almost 400 of the animals have been held in corrals inside the park for testing to see if they have been exposed to the disease brucellosis. Officials had planned to begin this week sending those buffalo that tested positive to slaughter. But environmental and American Indian groups are seeking a restraining order from the federal judge in Helena, Montana, to block the shipments. No shipments are expected while the legal challenge is reviewed. Brucellosis can cause wildlife and livestock to prematurely abort their young. About half of the park's bison carry the disease. However, no bison to cattle transmissions have ever been recorded yet. And today we go to Shoshone Bannock correspondent Mark Trahant of IndianCountryTV.com to give us an update on some legislative issues. Mark Trahant, give us a little update about some of the legislative affairs and issues going on. Give us a view about what's happening around the country with healthcare and some of the other issues.
Sure, Paul. There's kind of a battle going back and forth over healthcare reform. And it's taking many, many forms. One of the ones that I think is interesting is the idea of nullification, that states could decide on their own to nullify a federal law. That's happening in my state of Idaho, which is, of course, I hate to see any state on the side of John C. Calhoun and the pre-Civil War era discussions. This has, I think, some really interesting twists. One that I think is just extraordinary is that states have a real power, and that is they could withdraw from Medicaid, but because that's a voluntary program. But no state wants to do that because their constituents that benefit from Medicaid are primarily the elderly. Medicaid represents 40% of all nursing home payments. So that would put them, I mean, they'd be defeated if they did it. So they pick on things like nullification instead.
Okay, nullification means that those things adopted under the Healthcare Improvement Act and that whole budget, they're saying they have the discretion of saying they don't need that to implement that. The state has the right to say the federal government can't tell us what to do that. On the other hand, Medicare is voluntarily.
Right, Medicaid.
Right. Medicaid is voluntary for each state to do. So this is going to be litigated. Isn't it? So for example, a state legislature or a governor says we're not going to follow that, but don't they have to file? What's the process for nullification?
Well, that definitely will be litigated, and it's both arcane and the law is pretty well settled. So it'll be interesting to see how much truck they actually get with it. There are some really important ramifications for states that choose this route. If they choose not to go ahead and implement the law, that means they're not going to design their own state exchange for the insurance exchange, which means that the federal government can do it without the state. And to my way of thinking, that's not necessarily a bad thing because you have a much broader pool, you have more people being able to get into it. Indian country can certainly choose to join up with the exchanges to supplement what they would get with the Indian health system. So I think it opens up a couple of possibilities.
When you talk about nullification, does that nullification in any way impact tribal government healthcare issues within those states or urban healthcare as far as you know?
Not really. The real rub is going to be, well, urban care, yes, it would affect that much more so than tribal. Where it does impact is the states write the rules for Medicaid, and as they get stingier and stingier, they've been doing more to make payments not pay for some bills that they would have paid for last year. The federal government has told them they can't change the eligibility rules, and for the most part, they're sticking with that.
Does this provide for any opportunities for reallocation of resources? For example, we in the state of Wisconsin, we got a Republican governor who immediately, for example, shut down the light rail project here, and the money was
Right.
instantly reallocated to some other state where they're going to put people to work somewhere else rather than Wisconsin. Is are any of those kinds of things occurring within this nullification? Someone doesn't want this health care, there's no money, they reallocate it somewhere?
Certainly down the road that could be. Right now, nullification is more theatrics and bluster than actual policy. So at this point in time, it wouldn't affect reallocation.
How many
But it
states?
could down the road.
How many states are we talking about at this point?
Um, Most of the states that have toyed with the idea have rejected it, and I think we're down to about four or so that are actually seriously continuing going forward.
Okay, well, that's nullification now. That doesn't impact what's going on in Congress, and there seems to be lots of theatrics and the beginning of the process up there. What
Right.
can you tell me about what's going on up there with the budgetary process starting to open up?
Well, a number of budgets have surfaced, and the president's budget comes out next week. The House Republican budget, its big impact is it would take a deep, deep cut in community health centers, which the Indian health system does participate in. A $1.3 billion cut, so it's pretty substantial. Um, Other than that, it would be much more minor cuts. Other Republicans, however, though, have pushed for broader cuts, including the most radical being Paul Rand of Kentucky and the House Tea Party caucus, calling for rolling back all spending to 2008 levels, which would be about a 30% reduction at the Indian Health Service. And the director has already talked about how devastating that would be should that come to pass.
Let's get some clarification on that too. Are we talking about appropriations for the next budget year? Because the original vote seemed to say we want to bring this year's budgetary spending back down to 2008. Is there a difference?
They're talking about this year, and that means the budget's impact is twice as hard because we're halfway into the year, and so they would have to make up a lot of ground very quickly. The Senate's going to hold firm, so they're not going to get that. But how much they do get, whatever sort of compromise, could be devastating. If there is no compromise, you could look at the government shutting down in parts or all as soon as March.
Right, that reallocation comes up there. Do you think there'll be a shutdown? There has been, what, 10, 15 years ago, there was a shutdown at some point. I remember that for a week or two, and agencies begin shutting their doors.
I think the potential here is really great, partly because of the deep ideological divide, but also because the Republicans have a couple of triggers. One, the expiring continuing resolution on March 4th, and also the federal government is going to have to ask for more debt limit. And those two things working together, I think, could be an important factor.
And by saying they don't want to renew the debt limit or raise it, the pressure is on for people to make substantial budget cuts as a trade-off between
Right.
the ideas.
It's like the credit card limit, and if the United States does not pass a debt extension, essentially it would be defaulting on some loans. One of the more bizarre theories out there is that some Republicans have said, let's pay the debt and nothing else, and use that as a mechanism to shut down the government.
Well, that would be interesting. Um,
Right.
and would that be interest in principle or anything? They would just make a payment on debt, but allow the expenditure end of it to come to an end.
Right, right. So much of this
Risk,
comes down
risky
to
though, risky, isn't it?
it's extraordinarily risky. I mean, in some ways, when you look across the globe and see things in Egypt and think this could never happen here, it could happen here. And I think some of the divides we have are as great as we've ever had, and certainly could lead to something like that.
I have an odd question that popped into my mind from some of the things I was reading today. It seemed like in the last couple of days, we had a senator here, Senator Feingold, who voted against the Patriot Act. If I remember right, he was maybe maybe the only person, maybe one of a few who voted against it. He got called all kinds of names, unpatriotic, yeah, communist, yeah, liberal, and all that. In the last couple of days, I heard there was a vote having to do with the renewal of the Patriot Act. and Tea Party members voted against it in conjunction with people way over on the left side of
Right.
the aisle. Tell me how those dynamics jive in Congress on some of these other issues. Are we going to see some real bizarre alliances going on to accomplish some of these things?
I think
Seems bizarre to me anyway.
Yeah, I think less so than other issues. I mean, this is classic libertarianism where keep the government off my back. When it comes to spending, I think that same issue won't pop up the same way. What you will see, though, is the Tea Partiers trying to pull the Republicans into a spend no money on anything type of thing. One of the strategies that many tribal leaders are pushing is to try to promote the idea that tribes are part of the Constitution and that there are constitutional authorization for this spending to try to mull some of the Tea Party folks. I'm not sure that's going to work because they follow the Constitution when they want to, and they don't follow the Constitution when they want to. So, I mean, look at immigration. It's very clear from the Constitution that someone born in this country, no matter what, is a citizen, and they're trying to stop that.
Seems like a real frivolous argument when they got a huge uphill battle on their agenda in the first place.
Right.
So we're already seeing some of the impacts of the budget cutting. There, you know, for example, as a public media communications agency, there's been several federal agencies that have already let us know that due to budget cuts, they will not be placing, for example, outreach programs and advertising and those type of things. They seem to have hunkered down in case these budget cuts become reality.
Well, and let me talk to that because I think it's really important. One of my greatest concerns is that the policies that are being promoted are deflationary. They will cause less spending, people to have less paychecks, less support for everything else, and that will end up putting the country into a tailspin that I think is significant. And the more they try to cut their way out of this problem, the more likely that occurs.
That's returning us to the recessionary situation. For example, people who are getting ready to spend are now beginning to save money in case there's further budget cuts and less revenues, it would seem to me. And aren't these wonderful proposals about budget cutting and deficit spending and all kinds of things? I mean, there's no doubt that there's some need, but until they begin to impact individual programs and individual people, there's going to be a lot of people who are going to like them until all of a sudden they don't have those services.
Exactly. That's going to be the big fight over the next few years.
National Congress of American Indians has tried to get out in front of it, making some of their own budget proposals and getting their lobbyists in gear to trying to shore things up. Is that going to work?
Sure hope so. It really comes down to what kind of ability to bridge this divide there's going to be from all sorts of things. As long as pure ideology rules, I don't see any solution. As long as reasonable people look for solutions, then yeah, we can come up with lots of options.
Is there any relief from tribes forging better relationships with state governments, county governments during some of these potentially trying times?
Probably, but the thing is, well, let me answer that two ways. One, states and county governments are in worse shape than the federal government, and that situation is going to get bleaker. Because they have to balance their budgets every year and don't have deficit spending, so they have to come up with a way to balance it. I think there's an opportunity for tribes there, and that is programs that have been contentious over the years, like jurisdiction, tribes could start acquiring because the states don't have the money for it. So it may be a great opportunity for tribes to assert their governance status.
Okay, thanks for joining with us today. We'll go to marktrahant.com for some of these columns and comments.
Sounds good.
Thanks, Mark.
And that is the latest roundup of news from Indian Country on this edition of the Native News Update. Miigwech for joining with us. Come back again soon.